In 2010, President Obama signed the Affordable Care Act into law. Commonly referred to as Obamacare, the law has helped an estimated 20 million Americans get health insurance since its rollout. However, 32 million Americans still remain without coverage. While many are unable to receive coverage due to gaps in Medicaid or high costs, an estimated 50% of the uninsured population is eligible for financial assistance and is not taking advantage of it. Johnny Johnson used to be one of these people. Johnny's had a number of jobs throughout his lifetime, all of which provided health insurance.
And I had good insurance, and I was doing that, using my insurance. And one of the good things about that was I was healthy, and I was utilizing going to the dentist and going to the doctors on a yearly basis, and it was great.
However, when he became unemployed, Johnny lost his coverage. Like many people without health insurance, he was forced to turn to other options.
When I didn't have health care, I self-medicated. I had a stroke and 2 heart attacks without insurance.
In these instances, the advice of friends and the effectiveness of home remedies became matters of life and death.
Well, knowing that apple cider vinegar and honey can help me because it thins your blood, which it did. So as a stroke was coming down my right side, and coming down my right side, I had taken the apple cider vinegar real quick, and the stroke, they opened up my vessels and thinned my blood, and it's gone. And then I had my first heart attack. I had the first heart attack again. I felt the pain. I don't like pain. I felt it, and I quickly went to apple cider vinegar and honey.
After a third close call just days later, Johnny decided to look for help from Obamacare. Thanks to the expansion of eligibility, Johnny was one of 200,000 people in Connecticut to receive coverage under Medicaid. He immediately used his insurance to get an MRI, the results of which shocked his doctors.
The doctor says, Mr. Johnson, this report here says you had a stroke and a heart attack. I said, I had 2. so he says, so what happened? I said, hey, I did apple cider vinegar and honey.
Unfortunately, Johnny soon found himself cut off from Medicaid. This is not uncommon, as many people fall through the cracks of the system for unclear reasons. Johnny returned to self-medicating and was doing well until things took a turn for the worst.
After that, my mouth, I started bleeding from my mouth. So in June all the way down to July 4th, I was bleeding from my mouth. And I didn't know what it was, but my stamina was getting real bad, and I didn't have no health insurance.
Without coverage, Johnny was worried about the cost of seeking help. Finally, after his condition continued to deteriorate, his friends were able to convince him to go into the St. Francis emergency room. While talking with the ER doctor, Johnny raised concerns about his lack of insurance.
I'm in this beautiful, luxurious room, and I'm saying to him, I don't have no insurance. And he comes back and says, that's no excuse. Everybody deserves quality health care. And I was blown away with that.
St. Francis helped Johnny re-enroll under Medicaid, and once again he was able to receive treatment thanks to Obamacare. Unfortunately, Johnny's excitement was short-lived when he received his diagnosis.
And so I came here thinking that I had the flu, not knowing that when they gave me the diagnosis on July 6, 2015, that I had leukemia, cancer, AML.
When he was admitted, Johnny was in the worst condition of all the patients in the cancer unit. He immediately started an aggressive chemotherapy treatment.
Do you know Muhammad Ali knocked George Foreman out in the 8th round? Well, I did 8 rounds of chemo, over 823 hours of chemotherapy.
After his 8th round, Johnny was declared 99.99% cancer-free. He had beaten leukemia. He now is investigating getting a transplant to help his body recover from the effects of chemotherapy.
Without Obamacare, without any insurance, for me to even think about a transplant would have been probably not in my thoughts at all. And so when you talk about Obamacare and how you feel about it, I feel great about it. If I was still self-medicating, the probability of me being a dead man was great. If those are people who are doing that, I say go and get a doctor right now, get yourself checked, and get yourself checked annually so you don't have to discover whether or not you have a debilitating disease like I have on the fly.
For the millions of Americans like Johnny that receive coverage under the Affordable Care Act, Obamacare may have literally saved their lives. However, millions of Americans that already had coverage have been negatively affected by the law. Dr. Robin Santiago had to switch insurance plans as a result of Obamacare. However, her bigger concern is the effect that Obamacare is having on the healthcare landscape.
So one of the things that's happening is that in an effort to reduce the fees, something has to get reduced. So there's been for many years already, a huge pressure on physicians and hospitals to reduce the cost of care. Something has to give in the system. And so one of the things that gives is that we have less time with our patients, or we give more of the ancillary services that we might have handled to our assistants. How many people are seeing a physician's assistant instead of the physician?
Dr. Santiago is concerned that the attempts to lower costs is creating a tiered system.
There are places where services are provided for less. And I would say, let's talk about hotels. You can go to Motel 6, and you can have a bed, and you can have a bathroom, and you can go to the Ritz-Carlton. There's a choice. That's what's probably going to happen in medicine. There's going to be a tiered system, and those people who are restricted to insurance are going to be able to be serviced in places that can afford to service the patient at a lower cost.
The problems discussed by Dr. Santiago, as well as the ones that prevented Johnny from receiving coverage, have remained unfixed due to a lack of cooperation in Congress. Meanwhile, 32 million Americans wake up each morning without health insurance. Every day, the dangers of self-medication and undiagnosed illness remain a constant threat. While many simply need to ask for help, millions of Americans are stuck, waiting for Congress to work together. For them, this is about more than just politics. This is a matter of life and death.